World War II. Veteran co-founds Nurse Practitioner program. A nationwide shortage of physicians in rural areas spurred a World War II nurse to work with a pediatrician and create the Nurse Practitioner program in 1965. Loretta Ford, a native of the Bronx, New York City, earned her nursing diploma in 1941 and was working at Middlesex General Hospital in New Brunswick, New Jersey, when her fiancé was killed during World War II. His death inspired Ford to serve as a nurse in the Army Air Forces, which later became the Air Force in 1947 after it split from the Army. During the war, she served at military base hospitals in Maine and Florida. Following the war, Ford used her GI Bill to attend the University of Colorado, where she earned a bachelor's degree in nursing in 1949. Throughout the 1950s, Ford was a public health nurse for Boulder County, Colorado. It was a rural area with a lack of medical care availability, so she and other nurses set up temporary health clinics. Those experiences influenced her thinking that nurses could fill in for medical doctors if given some extra training. In 1965, Ford worked with pediatrician Henry Silver to create the first nurse practitioner program in the United States at the University of Colorado. She earned a doctorate in education from the same university in 1961. Ford, born Loretta Finkstel December 28, 1920, married William Ford in 1947. They had a daughter, Valerie Monrad, who now lives in Inverness, Florida. At age 100, Ford received the Surgeon General's Medallion, the highest civilian honor given by the Public Health Service. She was also inducted into the National Women's Hall of Fame at age 91. Ford died January 22, 2025, at her home in Wildwood, Florida, at age 104. In 1971, Elliot Richardson, the Secretary of the Department of Health, Education and Welfare, made a formal recommendation for expanding the scope of nursing practice so that nurses could serve as primary care providers. The Health, Education and Welfare later became known as the Department of Health and Human Services. That recommendation has been enacted in most states, where nurse practitioners, acting as primary care providers, can perform many of the same tasks as medical doctors, including performing diagnostic procedures and evaluations, ordering lab work or blood tests, and prescribing medications and treatment plans. Nurse practitioners have since risen to many high-level positions. Susan Ortega, a nurse practitioner and a Rear Admiral in the U.S. Public Health Service Commissioned Corps, served as the acting U.S. Surgeon General January 20, 2021 to March 24, 2021. Notable quote of Loretta Ford. "I'll tell you what I'm most proud of. I'm most proud of what the nurse practitioners are and have been doing and how they are our friends in terms of the health of people. Because I haven't met any nurse practitioners who are not just delighted with their role, and I think it's helped nursing so that we can help others. I'm more proud of that than anything." From a 2022 interview for Healthy Women. Awards. In 1989, Ford received the Ruth B. Freeman Award in the Public Health Nursing section from the American Public Health Association. In 1990, she received the Gustav O. Lienhard Award from the National Academy of Medicine. Ford was named a living legend by the American Academy of Nursing in 1999. In 2003, she received the Lifetime Achievement Award from the Nurse Practitioner. She was honored with the Elizabeth Blackwell Award from Hobart and William Smith Colleges that same year. The award honors a woman whose life exemplifies outstanding service to humanity. She was inducted into the National Women's Hall of Fame in 2011. In 2012, she was inducted into the Colorado Women's Hall of Fame. Ford held honorary doctorates from 6 universities.